What's up, y'all? I know it's been a few days since I've gotten a chance to upload anything. It's been super busy. Another night, evening call. I'm here till midnight helping the team out. So last few days have been pretty good. Got in on a couple really good cases in the OR. Got to see some wild stuff, learn a lot. I think at some point I want to get on here and actually do a little overview of a FAST exam. A focused assessment with sonography in trauma, like in the trauma setting. So great way to assess a patient for internal bleeding in like less than 3 minutes. So really good indicator. And so I think I'd like to run that down on here once, just because super helpful, and I think a lot of PA schools especially kind of blow past it. So I'll try to get something like that up. Right now, just working on getting some discharge stuff in for some of our patients. Just kind of here to lend a helping hand wherever it's needed until midnight, and then weekends off. Might try to get into New York City with a couple of my fellow residents tomorrow. Take a trip down there and just hang out for the day. As you can see, the stress acne is real. This is uncut and unedited, so we're gonna keep it 100 in here. Long days and greasy days, and that's what happens, so it's expected. My current favorite move is the hospital ginger ale for the patients. A cup of ice. I go through a lot of this, almost as much as coffee. It's a good move, keeps the stomach settled. I don't think I have anything else right now. No, that's about it. Might check back in again before midnight if anything cool happens. We'll see. All right, peace, guys. What's up, y'all? Almost out of here. Another long night in the books. I got like an hour left. Evan, finish up his note. Working his ass off. Hardly working. Probably the latter. Oh, here, you guys can meet Matt. What's up, Matt?
What's up?
Matt's a med student. What are you? An MS what?
3.
MS3?
Yeah.
This guy's gonna be smarter than all us bum PAs, but yeah, so going strong. Tonight's been quiet, maybe too quiet. We'll see what the next hour brings. All right, y'all, I'm finally home for the day. It's about 1:45. So I'm gonna try to get to bed pretty quick and get caught up on some life stuff, some laundry and cleaning up my place and stuff tomorrow. But real quick, getting ready to do some laundry, and I'm cleaning my Whitecoat out. And I thought it'd be at least semi-useful for anybody that was interested in going into like a surgical field, to kind of show you guys what sort of, is what at least I think important to kind of keep in your Whitecoat. At least from like a surgical standpoint. So this is just my patient list over here, but so this is kind of some of the basic stuff that at least most of the surgeons on our service use as far as like dressing changes. Want to have some gauze pads with you, maybe an ABD pad, and then most of them will use this Seroform petroleum-based dressing. It's got some like antibacterial effects to it too, so they like to use these a lot. So I always have some of those with me. This is just my schedule. These are actually really nice to have. This is a copy of our hospital's antibiogram. So it actually shows most of the regular or more common antibiotics that you'll be using, and then the percent susceptibility that some of the common organisms we cover for have. So most hospitals will have one of these. Just find yourself an updated one wherever you work. They're really nice to have. These are not really important. These are just some other random papers I have sitting around. It's a notebook. It's kind of used to pretty much take notes randomly on lectures that we have and stuff that surgeons say that I think is important. I keep a couple IVs with me. I think I keep like a 20 and a 22 gauge. And then an extender kit for them, but basically, when you're on the surgical service, if a rapid response is called, that's your primary objective. If IV access is needed and it's not established, that's what we get called for. Keep a couple saline flushes in my pocket. Good to like flush out a catheter, flush out a drain that is left in after a procedure. So those are nice to have. Let's see. I always keep a pair of scissors with me in case you need to cut some dressing material, or you need to cut a suture that's holding a chest tube in. They're pretty much nice to have for just about anything. These you don't really have to have because you're never going to be suturing with anything that's not sterile, but I keep these clipped to the lapel on my Whitecoat, and it's just a needle driver, but I find that especially in my downtime, I'm always kind of messing with them, holding them at different angles, mimicking like a needle driving motion, but it helps with my suturing, just to kind of have it and keep it in my hand, so it's nice to have. I always have tape with me. I always have silk tape, and I have paper tape because some patients, especially some of the older patients, have really sensitive skin, and the silk tape can be hard on it, so keep paper tape as well. Alcohol prep pads, kind of keep your patient clean when you're dressing them. I keep surgical ties with me. More as, again, like a training than anything else. I'll pick them up and kind of tie them on anything. Practice my one-handed, my two-handed surgeon's knots. Don't ever run out of pens. Number 1 rule is to have a pen with you at all times. Number 2 rule is to always have a pen for a surgeon. I keep a skin pen with me, kind of monitor progression of skin infections. I always keep an expo marker in my pocket because all the patients have whiteboards in their rooms, and a lot of times they won't write your name or your surgeon's name or whoever's covering your service. So I like having one of those available just to kind of update the patient on who's going to be taking care of them. I keep a portable charger with me at all times, especially for long call shifts. Nice to just be able to plug your phone into your pocket. It's just my Duquesne swag. I always keep that on the lapel as well. Gotta rep the hometown vibe. Let's keep batteries, extra batteries for my pager. Trauma shears. I keep these clipped on the inside of my lapel so they hang inside my jacket. In the trauma setting, first job is to expose the entire patient, so cutting clothes, cutting straps, they're really, really nice to have. This is just resident, surgeon, and other major phone numbers for the hospital. I keep one of those. This is a pharmacopoeia that actually the medical director from our PA program at Duquesne, shout out to Dr. Essig, made us pick up. Super nice, fits in your pocket really nice, and covers all the major dosing and indications for pretty much any drug out there, so that's nice. This is a fantastic little reference guide to have. Again, from Duquesne, one of the students ahead of us told us to pick it up. I think I paid like $6 for this thing, but it is absolutely phenomenal. It's got everything from ACLS protocol to lab conversions, ways to write your notes, and it's got a dermatome map. Like, this thing, for what I paid for this, is literally an indispensable piece of literature. So, and it fits really nice too. I always keep a trauma sheet from the hospital in my pocket because sometimes, you know, you can be in the middle of doing something else and a trauma gets called, so rather than having to dig for one of the forms to get the ball rolling on that, it's just nice to have one with you. Again, I always keep a copy of my surgical recall with me. And then what I think is the most important component, I always keep 2 K-cups in my pocket. You can always find a Keurig in the hospital, usually in the nurse's pantry. Shout out to one of my fellow residents for showing me this trick. Yeah, you can always find a Keurig, but keep the K-cups on you and keep you fueled up for ever. That's all I have. I'm gonna get some sleep, and that'll be it. See you guys. Have a good one.